Okay, so we're looking at the basics of the urinary system on this model. Obviously, these are our kidneys. These are the adrenal glands that sit on top of the kidneys. They're part of the endocrine system. They sit in adipose tissue above the kidneys. The major blood vessels, which, as I said, I'm not going to ask you about the major blood vessels, but of course these are the renal arteries and renal veins going in. After urine is made in the kidney, it flows through the ureters, which simply transport urine from the kidneys into the bladder. So they enter through these little holes, two little holes here, is where urine enters. This entire area, so first of all, this is the bladder. This area right here is called the trigon. It's a smooth area. That's where the urine comes in from the ureter into the bladder. And then, so those two openings, then it also has an opening for the urethra. So in any case, this is the bladder. It's made of, the muscularis externa is called the detrosor muscle. So when the detrosor muscle contracts, it pushes urine out through this opening, which is the urethra. If you notice the ridges here, the ridges are called rugae, similar to the stomach. So they allow expansion of the bladder for more urine to be held. Now, around this area, part of the muscularis externa layer, is the internal urethral sphincter muscle, which again you can't see, but is a muscle that encloses this tube, the urethra. It needs to be relaxed in order for urine to leave the bladder. As an adult, we have voluntary control over that and can contract it, thus hold the urine here before time where we can get to a restroom, and then we can voluntarily relax that and urine can be released. Now, this is a male bladder. How do you know? Because this area here, this is the prostate gland. It should not be found in a female. Alright, so urine leaves here, goes through the urethra to the outside of the body. I think we got it.
Okay.